Hey everyone, and welcome back to Thinkiverse podcast on YouTube. I'm Ryan Lamas,
And I'm Rana Estolfo.
and we are so excited for today's deep dive.
Yeah, we're going to be talking all about a medication that's been making a lot of headlines.
It's called semaglutide.
And it seems to be pretty effective for weight loss.
Not only that, but
Yeah.
early research suggests that it might even help protect against Alzheimer's disease.
It's pretty fascinating stuff.
It is.
So, semaglutide, it was originally developed to treat type 2 diabetes.
Okay.
But now researchers are finding all these other potential benefits.
Even for people who don't have diabetes.
Right.
That's pretty cool.
Yeah.
So we've got a ton of research articles here.
Could do.
Clinical trials, reviews,
Those pieces.
everything we could find about semaglutide.
All about semaglutide.
You're going to unpack all this information and figure out what it all means for you.
Let's do it.
So, first things first, how does semaglutide actually work?
Well, it all starts with a hormone in our bodies called GLP-1. And this hormone, it helps regulate our appetite and how much we eat.
So it's like the I'm full signal.
Exactly.
So does semaglutide just like boost that signal?
Well, yeah, you could think of it that way.
Okay.
So imagine your brain has these special doorways,
Okay.
and we call them GLP-1 receptors.
All right.
And GLP-1, that hormone we talked about, it's like a key that unlocks those doorways,
Okay.
sending a signal to your brain saying, hey, you're full, stop eating.
Makes sense.
And semaglutide, it acts like a copy of that key.
Oh, interesting.
It fits into those same doorways.
It's like tricking your brain
Yeah, kind of.
into thinking you've eaten more than you have.
Right.
Clever.
And so because you feel fuller sooner, you naturally eat less.
Which can lead to weight loss over time.
Exactly.
That makes sense.
Makes a lot of sense.
Now, are there any downsides to this? Like, what about side effects?
Good question. So the most common side effects that people report are things like nausea, vomiting, and diarrhea. Not the best, but they're usually mild and tend to improve over time.
So manageable.
Yeah,
Okay, good to know.
but it is something to keep in mind.
For sure.
For sure.
So it seems promising for weight loss.
It really does.
But here's where it gets really interesting.
Okay, tell me more.
A recent study suggests that semaglutide might actually lower the risk of developing Alzheimer's disease,
Wow.
especially for people with type 2 diabetes.
That's incredible.
That is how wild?
That is wild, and this is still early research.
Right.
But it's super promising.
Very promising.
Yeah.
Okay, before we get ahead of ourselves,
Yeah.
I want to remind everyone that we are Thinkiverse podcast on YouTube.
That's right.
We're all about unlocking knowledge across the spectrum every day.
Every day.
If you are enjoying this deep dive on semaglutide,
Race.
hit that like button
Yes.
and subscribe to our channel
Please do.
for more fascinating topics just like this one.
We love doing these deep dives, and we have so many more planned.
We do.
So stay tuned.
We're just getting started. Okay.
Okay.
Now back to this Alzheimer's connection.
Okay.
How could a drug that helps with weight loss
Mm-hmm.
possibly be linked to preventing Alzheimer's?
I know, right?
Like those seem like totally different things.
Totally different things.
What's the connection?
Well, researchers are still trying to figure out exactly how it all works.
Okay.
But here's what we know so far.
Okay.
Things like high blood sugar,
Okay.
obesity, and cardiovascular problems can increase your risk of developing Alzheimer's.
Right.
Yeah.
So is it possible that by improving these risk factors through weight loss,
Uh-huh.
semaglutide is indirectly protecting the brain?
That's one of the leading theories.
Interesting.
Yeah, it's like a domino effect.
Okay.
Semaglutide helps you lose weight, which in turn helps control your blood sugar,
Okay.
improve your heart health.
Right.
And all of these things can have a positive impact on brain health
Fascinating.
and potentially reduce the risk of Alzheimer's.
So it's like a whole cascade of positive effects.
Yeah. Exactly.
Wow, that's pretty incredible.
It is.
But it's still early research.
It is.
We don't want to give people false hope,
Absolutely.
but it's very promising.
Very promising.
Now, you mentioned that some studies showed pretty impressive weight loss results.
Uh-huh.
How much weight are we talking about here?
Some studies have reported an average weight loss of 10 to 15% of body weight
Wow.
over the treatment period.
That's significant.
It is significant.
That's a lot.
It can make a real difference in someone's health.
For sure. And that makes me think back to those side effects we were talking about earlier.
Yeah.
Do we know for sure that the weight loss isn't just because people are feeling sick and not wanting to eat?
That's a good question.
Yeah.
And researchers actually looked into that.
Oh,
They analyzed the data and found that only a tiny fraction of the weight loss could be attributed to nausea or vomiting.
so it's not just that people are feeling too yucky to eat,
Right.
It seems like semaglutide is actually changing how their brains are responding to food.
Yeah, it seems to be working through those GLP-1 receptors we talked about,
Right.
sending those signals of fullness to the brain.
Reducing those urges to eat.
Exactly.
Okay, that makes a lot more sense.
Uh-huh.
Now, one thing that struck me while we were going through all this research is that semaglutide seems to be effective for weight loss,
Yeah,
regardless of someone's starting BMI.
that's a key point.
Can you explain what that means for our listeners?
Sure, so BMI stands for body mass index,
Okay.
and it's just a way to measure body fat based on your height and weight.
Okay.
And what's interesting about semaglutide is that it seems to help people lose weight, whether they are just a little overweight or have a much higher BMI.
So it's not just for people who are considered severely obese,
Right, it seems to be promising for a wide range of individuals.
who are struggling with weight management.
Exactly.
Now, I know there are two different brand names for semaglutide,
Yes,
Ozempic and Wegovy.
that's right.
What's the difference between those two?
So they both contain semaglutide, but they are approved for different purposes.
Okay.
They come in different doses.
Got it.
So Ozempic is specifically approved for treating type 2 diabetes,
Okay.
while Wegovy is approved for weight management in people who are obese or overweight.
So if someone has type 2 diabetes and wants to lose weight, which one would they take?
That's a question for their doctor.
Okay.
While Ozempic can help with weight loss,
Right.
Wegovy is typically the go-to choice if weight loss is the primary goal.
Okay.
And in some cases, a doctor might prescribe Ozempic off-label for weight loss.
Off-label, what does that mean?
It just means they are prescribing it for a purpose that it's not officially approved for.
Okay, interesting.
Yeah,
So it's important to talk to your doctor
always a good idea.
to figure out the best option for you.
Exactly.
Okay, so we've talked about how semaglutide works,
We have.
its potential benefits,
Uh-huh.
the different brand names.
Yep.
What are some practical considerations someone should be aware of if they're thinking about trying semaglutide?
Well, one thing to know is that semaglutide is an injection.
Okay.
You administer it yourself at home once a week.
Okay.
Some people might be hesitant about needles,
Understandable.
but the needles used for semaglutide are very small and thin.
Okay.
Most people find that after a few times, it becomes pretty routine.
That makes sense.
Yeah,
I imagine cost is a major factor for a lot of people.
it is.
It's a relatively new medication,
Right.
and those tend to be more expensive.
They do.
So what can someone do if they're interested in trying it, but they're worried about the cost?
The best thing to do is talk to their doctor and their insurance provider
Okay.
to see what's covered and explore potential cost-saving options.
Like what?
There might be manufacturer coupons or patient assistance programs that can help.
Okay, that's good to know.
Yeah,
We've covered a lot of ground here.
we have.
What are some of your key takeaways for our listeners before we wrap up this part of the deep dive?
For me, it's the potential impact on both obesity and Alzheimer's disease.
Two huge issues.
Absolutely. Two major health concerns that affect millions of people worldwide.
Yeah.
So semaglutide offers a new avenue for research and potential treatment.
It's very exciting.
It is.
And it's important to remember that while the initial research is very promising,
Right.
more studies are needed
Definitely.
to solidify these findings and explore long-term effects.
Absolutely. It's a reminder that science is a process,
Always evolving.
always evolving, revealing new possibilities.
That's the beauty of it.
It is.
All right, we'll be right back with even more insights into this exciting medication after a quick break.
Stay tuned.
We'll be right back.
Welcome back to Thinkiverse podcast on YouTube.
We're diving even deeper into the world of semaglutide,
We've uncovered some really fascinating insights so far.
but there's still so much more to explore.
One thing that I think is really important to keep in mind is that this research on semaglutide is constantly evolving.
Oh, for sure.
It seems like every day there's a new study or a new headline.
Right.
Can be a lot to keep up with.
It can be overwhelming, for sure, especially when it comes to health topics.
Yeah.
Where can people go to find reliable information about semaglutide?
Well, I always recommend starting with your doctor.
Okay,
They are a wealth of knowledge and can help you filter through all the noise
that makes sense.
to find the information that is most relevant to you.
Right, because they know your specific health history and concerns,
Exactly.
so they can give you personalized advice.
Absolutely.
But there are also some great online resources out there.
Oh, yeah, for sure.
Like what?
Well, reputable health organizations like the Centers for Disease Control and Prevention,
The CDC.
the CDC, exactly, the
Yeah.
American Diabetes Association,
Huh?
the Alzheimer's Association.
Got it.
All of these organizations have websites with tons of evidence-based information.
And of course, you can always check out Thinkiverse podcast on YouTube.
Of course, that's right.
We're here to help you navigate the complex world of health and science.
In a fun and engaging way.
We'll try our best.
We do our best.
Now, speaking of the complex world of medications,
Yes.
let's talk about how semaglutide is actually used in practice.
Okay.
You know, I think some people might be surprised to learn that it comes in two slightly different forms.
Yeah, that's true.
So semaglutide is the name of the active ingredient.
Right.
That's the part of the drug that actually does the work.
Uh-huh.
But it's sold under two different brand names, Ozempic and Wegovy.
That's right.
So what's the difference?
So they both contain semaglutide.
Okay.
They're both given by injection,
Okay.
but they're approved for different purposes.
Okay.
And they come in different doses.
Got it.
So Ozempic is specifically approved for the treatment of type 2 diabetes.
Okay.
That helps people with diabetes control their blood sugar levels.
Okay.
And it can also help them lose some weight.
Okay.
Wegovy, on the other hand, is specifically approved for weight management
Okay.
in adults who are obese or overweight.
So if someone has type 2 diabetes and wants to lose weight,
Yeah,
would they take Ozempic or Wegovy?
that's a great question.
It's confusing.
It is a little bit confusing, and it's definitely a question that you should discuss with your doctor.
Okay.
There are some cases where a doctor might prescribe Ozempic off-label for weight loss.
Wait, off-label, what does that mean?
It just means that they are prescribing it for a purpose that it's not officially approved for by the FDA.
Okay, so it's not like it's dangerous or anything?
No, not at all.
It's just not officially approved for that specific use.
Right.
Okay.
But generally speaking, Wegovy is the go-to choice if weight loss is the primary goal.
So it really depends on the individual's specific needs and health goals.
Exactly.
Okay, so choosing between the two is definitely something you should talk to your doctor about.
Absolutely.
Now, I know we've talked a lot about the potential benefits of semaglutide,
We have.
but let's be realistic for a minute.
Okay.
Is it a miracle cure?
Well,
Is it going to work for everyone?
unfortunately, there are no miracle cures in medicine.
Right.
Semaglutide is a powerful tool, but it works best when it's part of a comprehensive approach to health.
What do you mean by that?
Well, it means combining it with lifestyle changes, like diet and exercise.
So it's not a quick fix.
Right. You can't just keep eating whatever you want and expect semaglutide to do all the work.
It's not a magic bullet.
It's not a magic bullet.
No. So if someone is considering trying semaglutide,
Yeah.
what should they do?
Well, the most important step is to talk to their doctor.
Okay.
They can assess your individual situation,
Mm-hmm.
discuss the potential benefits and risks,
Okay.
and determine if semaglutide is right for you.
And they can also help you figure out that whole Ozempic versus Wegovy thing.
Exactly. They can help you navigate all of that,
Okay.
determine the appropriate dosage,
Right.
and monitor you for any side effects.
It's always best to have a healthcare professional guiding you through something like this.
Absolutely.
Now, another big question that I know a lot of people have is about the cost.
For sure.
Semaglutide is a relatively new medication, which usually means it's more expensive.
It does tend to be.
So what can someone do if they're interested in trying semaglutide, but they're worried about the cost?
Again, talk to your doctor.
Yep.
They might be able to help you find ways to make the medication more affordable.
Okay, so like what?
Well, first, check if your insurance plan covers semaglutide.
Oh, wait.
Some plans do, some plans don't.
Okay.
And the level of coverage can vary widely.
So insurance is the first step.
Uh-huh.
What if insurance doesn't cover it?
Yeah.
Or what if the copays are still too high?
Well, your doctor can also help you explore other cost-saving options,
Nice
like
fix.
manufacturer coupons or patient assistance programs.
Okay, that's good to know.
Yeah, it's important to advocate for yourself
For sure.
and explore all the options.
Okay.
Now, before we wrap up this part of the deep dive,
Yeah.
I want to touch on something we haven't talked about yet.
Okay.
And that's the fact that semaglutide is an injection.
Right.
Some people might be a little hesitant about that.
I can understand that.
Needles can be a little scary,
Yeah.
but the good news is that the needles used for semaglutide injections, they're
Right.
very small and thin,
Oh, okay.
much smaller than the ones you might imagine.
Okay, that's good.
Yeah, and they're self-administered.
You don't have to go to the doctor's office every week to get it.
No, you don't.
That's nice.
You do it yourself at home once a week.
Okay.
Your doctor will show you how to do it.
And most people find that after a few times, it becomes pretty routine.
Exactly.
It's less intimidating than they expected.
Right.
Okay, that's reassuring.
Yeah.
And of course, if anyone is considering semaglutide and has any questions or concerns about the injections,
Of course.
they can always talk to their doctor.
Absolutely. Always talk to your doctor.
Okay, amazing. We've covered so much ground in this deep dive already.
I know, it's a lot.
How semaglutide works,
Mm-hmm.
potential benefits for both weight loss and potentially Alzheimer's disease,
Right.
the difference between Ozempic and Wegovy,
Yeah.
practical considerations like cost and how to give yourself the injections,
Uh-huh.
and even how to stay up to date on the latest research.
It's been a great discussion.
It has.
And we have one more segment coming up.
We're going to zoom out
Yeah.
and consider the bigger picture.
The big picture.
What does the emergence of semaglutide mean for the future of weight management and brain health?
It's a big question.
Stay tuned for the final part of our deep dive. Welcome back to Thinkiverse Podcast on YouTube.
We're here for the final part of our deep dive into semaglutide.
You know, we've explored the science behind it,
We've talked about the potential benefits,
the different ways it's used.
even some of those practical considerations.
Maybe it's time to zoom out.
Yeah, let's look at the bigger picture.
Okay, I'm ready for the big picture.
So, what does the emergence of semaglutide really tell us about the future?
Of weight management.
And maybe even brain health.
I mean, for a long time, we've been searching for safe and effective ways to help people who struggle with obesity.
Right, and the options have been pretty limited.
Yeah, we've got diet and exercise, which are super important,
Of course.
but sometimes they're just not enough.
Yeah, and then there are other weight loss medications?
But they haven't always been as effective as people hoped.
Or they come with some not so great side effects.
Exactly.
So semaglutide seems to be changing things.
Yeah, it's showing us that it is possible to develop medications that can really help people lose a significant amount of weight.
And keep it off.
Exactly, and not just a little bit of weight.
Right, we're talking about clinically meaningful weight loss.
Yeah, the kind of weight loss that can really improve someone's overall health,
Absolutely.
lower their risk of developing other problems.
Like heart disease or diabetes.
And then there's that potential connection to Alzheimer's disease.
I know, it's mind-blowing.
If the research continues to show what we've seen in those early studies,
It could be a real game changer.
for so many people.
Imagine a future where we could potentially slow down or even prevent Alzheimer's.
It'd be incredible.
It really would.
But like with any new discovery,
Of course.
there are still a lot of questions that need to be answered.
Absolutely.
So what are some of those challenges and uncertainties that researchers are still grappling with?
Well, one thing is we need more long-term studies.
To really understand the long-term effects of semaglutide.
Right, we know it's effective in the short term.
But what happens when people stop taking it?
Do they gain the weight back?
Do the benefits for brain health persist?
These are big questions.
They are. And I think another challenge is going to be access.
Yeah, for sure.
We talked about the cost.
But there's also the issue of availability.
Right, demand is so high right now.
There have even been reports of shortages.
So even if you have insurance that covers it and you can afford the copays.
You might still have trouble getting your hands on it.
Exactly.
Hopefully, as production increases.
And more generic versions become available.
Access will improve.
We can hope.
Fingers crossed.
So as we wrap up this deep dive, what are you most excited about when you think about the future of semaglutide?
I think for me, it's the hope that semaglutide represents.
Hope for more effective treatments for obesity and Alzheimer's.
Hope that we can help people live healthier and longer lives.
Absolutely. Well, I think that's a perfect note to end on.
We've covered a lot of ground today.
Yeah.
Explored the ins and outs of this fascinating medication.
Semaglutide and its potential impact on the future of health.
If you're interested in learning more,
Be sure to talk to your doctor.
and check out those reliable online resources we mentioned.
And don't forget to hit that subscribe button.
Right here on Thinkiverse Podcast on YouTube.
We release new deep dives every single day.
Thanks for joining us.
And we'll see you next time.